Good evening, Chair, Board members, and management. This is a quarterly update to our 2024-26 strategic plan. This report focuses on updates to proposals A and B, as well as narrative for each of the 5 initiatives. The strategic plan was developed in 3 board retreats, October of 21, October of 22, as well as August 2023. 5 strategic directions were created and coordinated by you through our consultant Bobby Ryder and approved November 28, 2023. At which time the executive team developed 5 working committees that were launched 1 year ago, January of 2024. Quarterly update reports have been provided to the board April, July, and October of last year. They are archived in board effect for your review. A board advisor policy was approved last year, which provides the board the ability to, in real time, provide input and feedback into the strategic plan. On the wall of the boardroom, you'll find the strategic direction chart, which lists strategic direction number 1, enhance total quality management. Number 2, implement a comprehensive long-term sustainability plan. Number 3, expand services and patients served. Number 4, community organizing to improve population health. And number 5, implement a special populations health plan. You'll find the leadership team listed for each initiative, as well as the volunteer board advisors. Strategic direction number 1, proposal A, is 100% completed. It was to reestablish patient-centered medical home certification, which was successfully recertified October 24, 2024 by the National Committee for Quality Assurance. This means that we are meeting stringent metrics from a patient perspective. It assures that we have ongoing best practices for primary health care at all of our Ampla Health clinics. Proposal B is 75% completed to improve clinical outcomes. 4 measures were tracked starting 4th quarter of last year: statin therapy, diabetic eye exams, diabetic foot exams, and chlamydia screenings. The goal is 5% improvements in metrics for all 4 over a 6-month time frame, and we have recruited and hired 7 personnel to assist in that process. Here's a sample of a certificate of recognition for our PCMH. This is for pediatrics, and each of our clinics has one of these certificates. Strategic direction number 2, proposal A, is to expand services and service area for changing needs 20%. We completed contracting with Partnership Health Plan in January of last year, which represents all of our Medi-Cal patients, and we continue to review and renew contracts to serve Ampla Health's patient population. Proposal B, design and implement a comprehensive energy efficiency plan. We believe that we're 25% into it. This will include compiling 3 years of energy costs by location, evaluating measures to reduce energy uses, review funding sources for energy efficiency options, and then present cost estimates to implement the recommendations that come out of this study. Strategic direction number 3, proposal A, expand the range and volume of services. We believe we're 85% complete. This really has been years in the making of this particular proposal. This last 12 months, we have opened a number of different locations which both expand the range and volume of what we're providing to our patients, including in Marysville Medical, the Cannery, 24 new exams. North Plumas and Yuba City, 9 exams. North Chico, 21 exam rooms. South Chico, 8 exams. Our Gridley expansion has 6 exams and a new nursing station. Our new Chico Dental, called Family Dental and Medical, has 14 dental operatories and 4 pediatric exams. And of course, on our corporate campus, we will have 54 medical exams, 37 pediatric exams, 20 dental ops, and 4 eye care lanes. Proposal B is to expand on-site access to eye care services at 85% completion. Optometric services were presented to the board in 2023, at which time we retained Neenan to help design and coordinate the construction of an eye care center at 1000 Sutter Street. They bid and retained contractors. You were involved in a beam signing ceremony that was held August 22, 2023 on our campus, and we're projected to provide eye care to our patients by April of 2025. These are some pictures showing some of the work that was done over the last year or two, including Marysville Medical at the Cannery, upper left, We have the expansion of Gridley to the right, a new acquisition in North Chico at 100 Independence Circle in the middle, along with our new Chico Dental location. Lower left is our clinic under the umbrella of the Jesus Center, and then lower right, an artist rendering of the completion of the Gridley expansion. Strategic direction number 4, proposal A, engage social determinants of health to improve population health at 25% completion. We've partnered with the Sutter Yuba Homeless Consortium May 8, 2024. We have a collaboration with Habitat for Humanity in December of last year with a pilot project called Home Sweet Home that engaged our outreach and CalAIM departments. Proposal B is 50% completed, which is to assess barriers and solutions to patient use of technology. This included partnering with Tri-Counties Community Center in Marysville to increase computer literacy and education training to our community. This was done in June of last year. We're pursuing donations of computers, laptops, and a printer to assist in this process, and we completed a community cybersecurity at home workshop November 2, 2024. Here are some pictures illustrating that activity with our outreach team taking gifts to one of the families. Lower right is our IT director who is presenting cybersecurity at home. Strategic direction number 5, proposal A, is to design and implement a plan to address all special populations. We believe that we're about halfway through this process. It includes identify and commit to participation in a cultural event with prioritized populations, pilot test and alternate service delivery model to bridge selected populations with Ampla Health Clinic locations, and proposal B, continue to improve access and health incomes through national ag worker initiatives at 25% completion. This is to identify key champions and stakeholders for implementation, assess migrant health funding with the migrant seasonal farm workers for budgeting goals, as well as an estimate of distance and travel times to Ampla Health clinics for the agricultural worker population to work at reducing challenges and barriers that they face. You'll find a more comprehensive report in your board packet, and the next presentation will be held April 29, 2025.